I'm Brian Jackson, Vice President and Chief Medical Informatics Officer for ARUP Laboratories. I'm also Medical Director for ARUP's Support Services Division, which handles most of our pre-analytic processes. If I were to ask you right now to picture in your mind an example of world-class customer service, there's a good chance you might imagine a scene like this one at a luxury hotel. At a luxury hotel, the customer is always right. The top luxury hotels will go far out of their way to fulfill even the craziest customer requests. This kind of service doesn't come cheap, but customers like it. If we were to take that luxury hotel model of customer service and apply it in our laboratory settings, though, we would run into problems. In our world, we strive for extremely high levels of reliability in order to optimize the quality of care. Achieving an optimal level of quality and reliability for lab testing requires that the upstream pre-analytic processes, such as ordering and specimen collection, be just as highly standardized and quality controlled as the within-lab analytic processes. The challenge here, obviously, is that many of these pre-analytic processes, such as test ordering and specimen collection, aren't being performed by laboratory employees inside the laboratory. Much of this pre-analytic work is being performed by people like doctors and nurses within doctors' offices and hospitals. If we were to treat each doctor or nurse as our customer in the luxury hotel sense, and allow them to interact with our lab in whatever ways match their personal preferences, then it would cause two serious problems. First of all, customization creates a lot more complexity for the lab, increasing both costs and error rates. And second, we would miss out on opportunities to actively manage the quality of the pre-analytic processes, such as test selection, specimen collection, and submission. So maybe this luxury hotel paradigm of customer service isn't really the right one for our clinical laboratory setting. But then what other paradigm of customer service should we replace it with? I'd like to suggest that a better paradigm, a better model of customer service for us to consider would be the personal trainer industry. A lot of people pay lots of money to personal trainers to not only tell them what to do, but to actually push them to do things that are really hard. So think about that, a customer paying you as their trainer to manage them. Here's another example. This one is a commercial pest control company. They're famous for their money-back guarantee. If the pests happen to return, they give you a full refund. Now think about this for a minute. Successful pest control requires not just the chemicals being applied by the Bugs Burger Company, but also cleanliness practiced by the customer. So if you're the customer and you hire this company, what they do first is come to your facility and sweep all of the clutter and dirt into the center of each room and leave a sign on top that says basically, if you want to be one of our customers, then this sort of clutter and dirt is going to be unacceptable. So either get your act together or you'll have to find a different pest control company to work with. In other words, they take a personal trainer approach to pest control. And you know what? They have the highest customer satisfaction scores in the industry. Because in the end, what their customers care about most is achieving a successful outcome. Here's another interesting example, Zipcar. If you're not familiar with Zipcar, it's an hourly car rental service. The cars in their fleet have designated parking spots scattered all around a city, and each car might be driven in turn by multiple customers over the course of a day. What this means is that there's no way for the company to clean each car and check the gas level in between customers. Rather, Zipcar has to rely on its customers to return each car on time to the right location, clean and full of gas. If any customer fails to do this properly, then the next customer is going to have a really bad experience. So how does Zipcar manage its customers so that they'll do what they're supposed to do? One of the ways it does that is through cultural interventions. Zipcar hosts social mixers and other events to reinforce the understanding that their customers are part of a community that's reinventing the future of urban living. And being part of a community reminds each customer that they have social obligations to the other members of that community, i.e. the other customers who are going to be renting those same cars. So how might we apply these principles as laboratories working with our clinical customers? The first step, certainly, is setting high-quality standards for both ourselves and our customers, and communicating those standards loudly and clearly. Second, we need to set and communicate clear expectations for our customers' behavior. Doctors and nurses are not experts in laboratory medicine. We shouldn't expect them to just naturally understand, for example, why it's critical to spell the patient's name correctly on a tube, or why drawing blood off an IV line could be a problem. We're the experts in these topics. So it's appropriate for us to be just as aggressive in managing doctors' and nurses' pre-analytic processes as we are in managing our own employees' processes. And that means things like measuring their behavior and their outcomes and giving direct professional feedback. The other principle to remember is that all of us, lab professionals, doctors, nurses, other healthcare workers, we're all part of a larger culture that puts patient needs first. In all of our interactions and communications, we as laboratorians need to explicitly refer back to that culture and explain that that's the reason that we're being so obsessive. We shouldn't put ourselves in a subservient relationship to the frontline clinicians in a misguided attempt at luxury hotel-style customer service. Rather, lab professionals, doctors, and nurses are all equal partners in the mission for high-quality patient care. And that requires that we all hold each other accountable. If you'd like to explore some of these ideas further, here's a book I recommend by Francis Fry and Ann Morris. It covers the Zipcar and Bugs Burger business cases, as well as a number of other examples. That concludes my presentation. Thank you for watching.